Good morning. Hope everyone is doing well this morning. I'm Megan Brown, Chief Marketing and Communications Officer for Munson Healthcare. And you have joined a live news conference today, and you will be learning more about the future of stroke care in Northern Michigan. We're so glad you joined us. Next slide. So today's speakers include Kathy LaRaia, Interim President and Chief Executive Officer for Munson Medical Center in Traverse City, Kersti Bruining. She is a neurohospitalist and the Comprehensive Stroke Program Co-Medical Director. Dr. Gary Rajah, Endovascular and Cerebrovascular Neurosurgeon and Comprehensive Stroke Center Surgical Director. Dr. David Rosenbaum-HaLevi, Interventional Neurologist and Comprehensive Stroke Program Co-Medical Director. In addition, Rebecca Avers is a registered nurse, and she is the Comprehensive Stroke Program Cardiac Cath Lab and Respiratory Therapy Nursing Director at Munson Medical Center in Traverse City. So as a reminder, we are on Zoom today, and we will take questions after the speakers provide their remarks about our announcement. But you can submit questions throughout the presentation by pressing on the Q&A bubble at the bottom of your screen. I will be able to see all of the questions that come in, but the other folks joining us for this news conference will not be able to see the questions. So I wanted to let you know that. With that, I'd like to turn it over to our interim president and CEO at Munson Medical Center, Kathy LaRaia. Kathy, take it over.
Well, good morning. I am so proud today, as Munson Healthcare is, to announce that the Joint Commission has certified Munson Medical Center as a comprehensive stroke center. This makes it just one of 221 in the United States, the 12th in Michigan, and the only one ever here in Northern Michigan, which is really important for our rural designation and all of the people that we serve. This designation speaks to the skills and designation of our healthcare team, who's been working on this since around 2020, and now we just got recognized by the Joint Commission for this wonderful effort. It's really important to ensure that more and better access is available to the individuals that we serve in our northern communities here in Michigan. This is where minutes matter. Really, attending to folks that are suffering from a stroke is really an important aspect of us being a tertiary care hospital and the designated specialty hospital here in Northern Michigan and part of Munson Healthcare. We've embarked on a regional transformation strategy that will really expand the tertiary care services that we offer here at Munson Medical Center. So this is a truly honor and recognition of the complete team that has put this together for us. So now I'd like to turn it over to Dr. Bruining to share moments about what is the comprehensive stroke designation.
Thank you, Kathy. Today's announcement is a culmination of work that has taken place at Munson Medical Center for over 2 decades. This work has included the establishment of an interdisciplinary stroke team in 2000, creation of a dedicated stroke unit in 2001, certification as a primary stroke center by the Joint Commission since 2012, and in 2020, the first endovascular stroke intervention by Dr. Gary Rajah. Munson Medical Center underwent a rigorous on-site review evaluating compliance with the Joint Commission's comprehensive stroke care standards. The review ranged from the first minutes of care by emergency medical services to hospital care by nursing staff, physicians, and many allied health professionals, to post-hospital care coordination. The review also encompassed imaging and communication technology, intensive care, neurosurgery, and interventional radiology staffing, and the staff and technology involved in program and data management and stroke research. The Joint Commission Comprehensive Stroke Center certification is the gold standard of stroke care designations, and it's designated for those hospitals that are raising the bar in evaluating and evolving patient care at every touch point of the stroke care continuum. Munson Medical Center now has the expertise and technology to treat any type of stroke. And in these last 3 years, Munson Medical Center has become the second busiest stroke center in the state of Michigan, having admitted over 2,500 stroke patients in that time. We are fortunate as a community to have access to this level of care, but even more to have this team of dedicated and compassionate people who use their expertise every day to save lives. Now I'd like to turn it over to Dr. Rajah.
Thank you, Kersti. Hi, everyone. I'm Dr. Rajah. Thank you for joining us. I'm going to go through just some of our program highlights over the last really 3.5 years since the interventional capabilities came online at Munson Medical Center. Just briefly, 1 in every 6 patients or people in the United States lack access to endovascular care within a reasonable amount of time, and the largest proportion of those patients live in rural areas. Northern Michigan and Traverse City are designated as rural areas. And this holds true across the United States. Most of the comprehensive stroke centers in the United States are located in larger metropolitan and suburban areas. Northern Michigan is now the exception to that data point. With close access in Traverse City, people in Northern Michigan will have critical time savings and preserving quality of life when minutes matter for certain types of stroke, known as large vessel occlusions or brain hemorrhages. Since 2020, we have gone through a large infrastructure lift here at the medical center, including bringing online 2 state-of-the-art Artis Icono biplane machines, just one of a handful in the country at that time back in 2020. This has really been a game changer for Northern Michigan patients and our community as far as what our capabilities are now and even in the future. Again, 3 years ago, really over 3 years ago now, patients having a devastating type of stroke, such as a severe brain bleed due to an aneurysm or a large vessel occlusion with a big clot, either in the carotid artery or in the head, would have to be transferred downstate. And we know that in the stroke world, time is brain and minutes matter. And these transfers could take, several hours, given the geographic disparity of Northern Michigan and how far away, downstate is. We fast forward to 2020, once we got the program off the ground, that changed completely. Patients were now able to seek care and complex level care here in Traverse City in Northern Michigan, making it both better for the patient and their families. We've equipped all of our affiliate hospitals throughout the region with specialized CT scanners and artificial intelligence, mobile technology to help triage and treat stroke or transfer to Munson Medical Center when appropriate throughout Northern Michigan, creating a type of stroke net. The comprehensive stroke designation is the most demanding certification in the country for stroke by the Joint Commission, and really speaks to the abilities of the hospital and the staff, the employees, and the outpatient care as far as what they're able to do, what they're willing to do, and how complex of a patient they can handle from start to finish. And, we're proud to say that now we can and are treating the most complex types of stroke here in Northern Michigan. This is a testament to Munson's commitment to Northern Michigan, our communities, and a testament to improving lives, saving lives every day. I'm privileged and honored to serve Northern Michigan in this way. I'd like to turn it over to my colleague, Dr. Rosenbaum. Thanks.
Thank you, Gary. So Dr. Rajah just spoke a bit about our new abilities to intervene in the acute phase of stroke. But when we're thinking about a comprehensive stroke center, we have to think about that word comprehensive. What does that mean? That both depth of care and breadth of care, in the sense that stroke is a process. There's a sentinel event where there's either a bleed in the brain or a blockage of flow to the brain, but we have to care for that patient from the moment the event occurred, sometimes for the rest of their life, because there could be significant sequelae of that event. So the designation of the CSC, part of that includes our ability to provide end-to-end care throughout the stroke process. That means when the stroke occurs, getting them acute care, whether that be TPA, clot-busting medications, or surgical intervention. It means getting all of their tests done at the highest level while they're inpatient in the hospital, putting them on the proper preventive medications. And then it means rehab, because there's injury very often in the setting of stroke that with extensive rehab can improve. With that in mind, to complement our extraordinary stroke care here at Munson Medical Center, we have a partnership with Mary Freebed, and that provides world-class inpatient and outpatient rehab services to help our stroke patients in their path of recovery, both in and out of the hospital. In addition to that, there's a lot of infrastructure and work behind the scenes that support those types of services. That's in the form of research, data management, and really leveraging technology so that we can continue to improve access to care and the quality of care that we give. This allows us to be part of a greater network of stroke care nationwide and even worldwide, where we're able to participate in research and really advance the care of stroke patients, both within our community, but all over the world as we partake in stroke care on a much higher level. And it's important to remember that there's the intervention, there's the treatment, but a lot of stroke can be prevented. And prevention really revolves around education with community outreach. It's a continuous process of learning and collaboration. And together with that and with our research capability, it really allows us to reduce the stroke burden within our community. So when we're talking about prevention, I think it's really important to just recall a very common mnemonic that we use in stroke care called the Be Fast mnemonic. We try to tell this to our community so that they remember time is brain. The faster that a patient gets to the hospital in the setting of stroke, the better their outcome will be. You know, at some point, damage is done and it's irreversible. So it's really important to get to the hospital and not ignore symptoms. So we use this mnemonic, Be Fast. B is balance, a loss of balance. Eyesight changes is E. F is for face, meaning that there's a drooping of the face. One side specifically is drooping. Arm or leg weakness is A for arm, but it could be arm or leg. S is speech, difficulty enunciating or also difficulty understanding speech. And then T is time, that if any of you experience that B, FAS, then T, time, call 911 immediately and get help as soon as you can, because again, time is brain. Thank you very much, and I'll turn it over to Rebecca Avers.
Hello. I want to thank our entire team for their dedication, tenacity, enthusiasm, and commitment to obtain this comprehensive stroke certification. The entire healthcare team, from the emergency departments here at Munson Medical Center and in our community hospitals, the EMS teams, our interventional radiology team, the intensive care unit, and our stroke unit on A7. A big thank you to all the people that care for our patients, our nurses, radiology, lab, pharmacy, anesthesia teams, and all of the support staff. A stroke can happen at any time and anywhere in the hospital, and all of our staff are trained to recognize and escalate the care that is needed. This was a true team effort to get to this point, to be able to elevate and serve Northern Michigan with higher levels of care for our stroke patients.
Thank you so much, everyone. Thank you, Rebecca. Thank you to all of our speakers. This is a really exciting day. We are the first ever and only comprehensive stroke center now in Northern Michigan. This is a big deal. So with that, I would love to go to questions that folks may have from the media. So as a reminder, you can press on the bubble on the bottom in the Q&A, and that would be helpful to do that now, and we can take some questions. So the first question we have, and I think the best would be Kathy LaRaia could start with this one, and then either Dr. Rosenbaum or Rajah can add in if they have anything additional to include. So Kathy, this comes from one of our reporters out in Cadillac. So what does this mean to regional hospitals in the Munson system like Cadillac? And how do we coordinate with some of those hospitals out in our communities that we serve?
So great question. And this is something that's already been worked on even prior to the designation as a comprehensive stroke center. And that is that we have communicated with our emergency services team, our emergency departments, and there's a couple of technologies that have been deployed so that this information gets right back to the providers so that they can determine if that treatment can maintain at that community hospital or when a transfer is ready.
Okay, great. Thank you for that background. If all the speakers could join on camera, that would be great at this time. And Dr. Rosenbaum or Dr. Rajah, do you want to describe how it is working with the community hospitals and maybe like an example of how that happens in the work that you're doing?
Sure. So I think just a quick word is, so the Munson system as a comprehensive system, but this was in effect even prior to this designation, works on what's called a hub and spoke model. So the medical center is the center point where all of our outlying hospitals send us their acute patients. This is facilitated in real time. We leverage a technology called Viz AI, which allows us to see real-time imaging performed at all of our outside hospitals on our cell phones as well as on our computers. We get real-time notification and real-time communication with all of the doctors and treating physicians at those outside hospitals so that we're able to facilitate triage and transfer of all of the acute patients as soon as possible. So we're really lucky that A, we have this network that's been running very efficiently, and B, that we have this technology that's able to let us do that in a very effective way.
All right, great, thank you. So there's a couple other questions we did get via email as well. Dr. Rajah or Rosenbaum, how many patients have we treated since 2020 when we did our first intervention?
I can take that. Since 2020, there's been over 300 just thrombectomies for emergent stroke.
Great. And then does this mean that we can now treat 100% of the kinds of strokes? And was there a time then, is that what we're saying, that we couldn't treat certain kinds of stroke here in Northern Michigan?
Yes, that's correct. We can treat any and all strokes currently. And since 2020, when we started having our interventional capabilities, and that also included some things in the operating room as well, being able to clip aneurysms, which is part of the hemorrhagic stroke. I think prior to 2020, if someone needed emergent thrombectomy, which is a procedure where we go up through the leg or the wrist and try to pull out a blood clot, or they needed an aneurysm coiled or clipped, they would have to be sent downstate prior to this program taking off in 2020. So yes, now we're able to handle all of that, and we have been really since 2020.
Great, thank you so much. All right, are there any other questions? We did get another question from a reporter. Will the recording of this presentation be shared with reporters? Yes, we can share a recording of this. And we will also have a final news release and a one-page fact sheet to send all of our reporters to right at the conclusion of this press conference. And let's see if we have any other questions coming in. Any final questions from the audience? All right, and for reporters, I did get another question via email about whether or not folks would be available for one-on-one interviews. We are going to make our providers here, so Dr. Rosenbaum, Dr. Rajah, and Dr. Bruining, available between 1 and 2 p.m. today. So I did see that a couple of our TV stations are on. If you are interested, please respond to either my email or Ashley Bartleson's email, which had our numbers to be able to set up those media interviews between 1 and 2 p.m. today for additional either in-persons with the TVs, or if you have additional questions on what this means. All right, well, with that, we'll wrap it up and we will send out the news release following this announcement. We appreciate you joining us today. And oh, there is another question that comes back. One more question from the media. So how will regional hospitals be a part of the research? Dr. Rosenbaum, do you want to take that one?
Sure. Yes. So the way they're part of the research is because all stroke patients within the Munson system are entered into our database. So again, just to reinforce this point, we are a system. It's not the medical center and our outside hospitals. We're all part of one stroke system. All of that data is collected. We have something called a REDCaps database with data managers who are very effective in capturing all of that data. All of our imaging data is kept in a central database as well. All patients that get any kind of intervention are coming to the medical center for that. So really, it's an integrated system. It's not discrete hospitals. And that's one of the advantages of having the CSC designation, is that no matter where you are within the Munson system, you're getting the same access to care.
Great. And how, can you talk about a little bit more about, you mentioned that because you talked about the system, Dr. Rosenbaum, how rare this is among rural healthcare systems in particular?
Sure. So yeah, so number one, it's incredibly rare among rural healthcare systems. Why? Because in order to provide the level of care for stroke that we're able to do at the medical center, you need a critical number of patients, right? So the work that, for example, myself and Dr. Rajah do, in order to have volumes to do these procedures, you need a certain size population, only because let's say 10 to 15% of stroke patients will get these procedures done. So the technology that's needed, the infrastructure, and the resources are very expensive. In most rural settings, you don't have a population that could support that. What's very unique to the Munson system is because it's an 8-hospital system over all of northern Michigan, which covers the entire segment of that geographical region, we're able to provide almost exclusive care to that patient population. By integrating all of those hospitals, we're then able to streamline all those resources in a very efficient way, and in so doing, provide really state-of-the-art stroke care, and that's a very unique situation from a logistical standpoint in the United States. Most rural areas might have a small hospital that might be either independent or affiliated with a given health system, a larger health system, a university health system. But then down the road or one town away, that affiliation might be with a different hospital. So they're contracted to send those patients someplace else. So nobody is really able to pool their resources in an effective way. And that means is that the patients who live in those regions either don't have access to care, or they're being transferred hours away from home, from their families. And in stroke particularly, time is brain. So those hours of transfer, that's time they're not getting treatment. So it's really important to appreciate what this means in a very real way for the community of northern Michigan. It's a wonderful thing.
Great. And to close it out, I would love to hear from Rebecca and then each of the doctors what this means to you personally, and then we will close it out from there if we don't have any other questions.
Yeah, thank you. I've had the privilege of joining the stroke team in the last year, learning from them and working with them, and that is greatly appreciated. Having this options for care here in Traverse City means tremendous for our families and our friends and everybody that we know in the region. So it's great to have the level of nursing care and expertise and the physicians here as well. So thank you.
Awesome. Kersti?
I've had the privilege, on the other hand, of being involved with the stroke program from the very beginning, and it's been an extremely exciting journey to see things grow and evolve. And it's very gratifying to me to know that my friends, my neighbors, my relatives, my community members have access to this very high level of care. It took a huge cooperation among hundreds of people in the team. It's a really big team that made this happen, and I'm grateful to all of them for that, and to Munson Medical Center for such support, Munson Healthcare.
And Dr. Rajah, and then Dr. Rosenbaum.
Sure. Yeah, I think there are only a handful of big opportunities in life, and I think that this is one of those lifetime achievements, lifetime opportunities to be able to create something like this from the ground up in a new environment that did not have access to that type of care. I think we've really pushed the needle forward for rural healthcare and also for our Northern Michigan community in a way that will continue to drive Northern Michigan and Traverse City and the community in general. You need good healthcare and you need good, especially emergent healthcare. And so that extends to things like interventional stroke capabilities, trauma care, and cardiac, emergent cardiac care. And we have all three of those things here in Northern Michigan through Munson Healthcare. So, I think in order to have a vibrant community, you need to be able to keep your members safe, well, healthy, return them to their loved ones, and keep their loved ones close to home when you're caring for them. And I think that's what we're doing. That's what we've done. That's what we will continue to do from here on out. It's been an honor, and we're going to keep pushing the needle forward, research and offering all of that to, more and more people throughout Northern Michigan, and education, which is a big part of what a comprehensive stroke center does, is reaching out to the community and helping with things like secondary stroke prevention, keeping people well so they don't have to come to the hospital and have a stroke to have their issues brought to medical attention. And, I think there's a lot of work that will, go on with that. But, I think this is one of those opportunities that you look back on and you really have to be proud of what you've done. Thanks.
Thank you. And Dr. Rosenbaum-HaLevi?
Yeah, thank you. I think I would probably echo the sentiments of my colleagues, Dr. Bruining and Dr. Rajah. As a physician, particularly earlier in your career, you've gone through so much training and so much schooling in order to be able to get to a point where you can actually provide your services to patients, and to be in a situation where all of that work that you've done for years, you're really able to make a difference to provide something that didn't exist before is very gratifying. In addition, the team here at Munson is just wonderful, and it's really a pleasure to work with people who are really unified in that vision. I love working with Dr. Rajah, Dr. Bruining, excellent colleagues and partners, the nursing staff, administration. It's just really striking to me how everyone from day one has really been motivated to push this forward. And that's something that shouldn't be taken for granted. Not everyone appreciates the impact that a CSC has on the community. So just being able to have that impact and work with wonderful people is really exciting and rewarding for me.
Terrific. Well, thank you all so much, and thank you again for joining us today. And again, we'll send out the news release right at the conclusion here. And if you do want additional follow-up interviews or you have questions, please reach out to Ashley Bartleson, who will provide her contact information in the news release as well. Thank you so much and have a great, safe day. Happy holidays.